This is the Treating Open Chest Wounds station. Because patient care is involved, gloves must be worn. In this case, we have an open chest wound, which is to say an open pneumothorax. The first provider begins by immediately telling her partner to cover the wound with a gloved hand to limit additional air entering the pleural space.
Can you cover that wound?
This prevents the injury from getting worse, while the first provider prepares by cutting or tearing 3 strips of tape. Unlike in a neck wound, we want to leave one side of the occlusive dressing open on a chest to serve as a flutter valve so that air can exit the space but not enter. A commercial occlusive dressing, the packaging from petroleum gauze, or as in this case, the packaging from a 4x4, usually make the best dressing. In a pinch, plastic wrap will work as well. In the package, minimizing contact with one of the clean insides, and then the clean side down across the wound.
You ready?
And then the partner can continue to apply pressure while the first provider tapes the top and 2 sides. The bottom will remain open to serve as the flutter valve. If there is sufficient bleeding to make it difficult for tape to stick, you can quickly wipe the worst of the blood away, but don't waste time trying to clean the wound. When it's done, there should be just enough give that the valve can puff upwards when the patient exhales, and then it should be pulled flat against the open wound when they inhale. If the patient were to start complaining of additional difficulty breathing or start to show signs or symptoms of a tension pneumothorax, we would then do what is called burping the dressing. This is done by waiting until the patient is exhaling and peeling up one side of the dressing while they exhale, and then put it back flat just before they inhale. This allows for extra air to exit the space to relieve pressure. If you need to put an occlusive dressing on and the patient's condition does not immediately improve, or if the patient shows any signs or symptoms of shock, you should call for an ALS intercept, as a pleural decompression may be necessary to save the patient. The skill is now concluded.